I'm honored that you can spend the next 45 minutes or hour discussing the topic of vitamin D. Folks already seem to know the routine because everyone is muted. So thank you all very much. I hope you found the chat box. So if there are any questions during this, you can feel free to type it in there, and it will make it a lot easier, and things will go smoothly, and you will have some privacy or not. I think it's a community forum, and my recommendation is probably let's not bring in personal scenarios so that it doesn't violate any rules regarding doctor-patient privacy. But I think this conversation is going to be relevant to all of you, and welcome, and I'm honored that you could spend your time with me. It's 10 a.m., so let's get started. I know folks have a lot to do on this beautiful Saturday. So the topic today is vitamin D. What is it and why does it matter? Many of you may be reading the lay press, and there has been some connection with COVID. So I think it's a very timely topic as well. And I've got a few slides at the end regarding the literature on that process. So let's just jump into it. So there are 13 essential vitamins, and vitamin D is one of the 13. That these essential vitamins means that our body needs these vitamins to work properly, either as cofactors for enzymes or skin integrity or memory or blood clotting function. And these are vitamin A, B, C, D, E, and K. Now, there are subcategories of B1, B2, B3, B5, B7, B6, and B12 and B9, and those are considered the B complex. There are fat-soluble vitamins that are stored in our body, and they can become toxic if we take too much of them. Vitamin B and C are water-soluble, and that means that you cannot overdose on those vitamins. So for vitamin D, why does it matter? Well, it is considered a pandemic right now, believe it or not, in terms of vitamin D deficiency. The CDC estimates 32% of children and adults are deficient. That means a level less than 20. I'd like all of you on this line to know that I know your levels because I monitor them routinely. It is estimated that 50% of the world population is at risk for vitamin D deficiency. In Australia, they learned that the slip, slap, slop for sunscreen led to a 40% reduction in vitamin D levels in their population. And then in India, more than 90% of healthcare professionals are vitamin D deficient. Vitamin D deficiency is becoming more prevalent in the United States than obesity due to a decrease in consumption of fortified milk and decrease in sun exposure due to our concerns about skin cancer. So what happens if we're deficient in vitamin D? In the 1800s, they discovered the onset of rickets and bowed legs and osteomalacia and increased risk in infections for children. At-risk groups currently are those babies who are exclusively breastfed for prolonged periods of time, older adults because we don't get enough sun and may not be getting enough fortification. If we're homebound or have limited sun exposure, and we'll talk about why sun cannot get through glass, dark pigmented skin, if you have an inflammatory bowel disorder because there's a diminished fat absorption, vitamin D is absorbed with some fat, and gastric bypass surgery. Sources of vitamin D. Well, vitamin D is considered the sunshine vitamin. And that's because it is created by sun sunlight striking the skin, and then I'll show you the pathway for that. And then our body will generate vitamin D just from that UVB radiation. And it depends on the angle, season, sunscreen, like I said, pigment, and our age. 20-year-olds will absorb the sun rays and create vitamin D threefold higher than if we're 80 years old. Milk fortified with vitamin D has been around since the early 1900s. Milk has about a fifth of your daily needs, 200 to 400 IUs. Cereals are fortified, orange juice and yogurt as well. Fatty fish or seal, whale blubber, polar bear liver are rich in dietary sources of vitamin D. And for every 100 IU ingested, our blood level is raised by 0.3 to 1.0 nanograms per milliliter. And we'll talk about some of the levels. Tanning beds may help patients with small, if you have a small bowel obstruction, resection, or malabsorption. So that means if you take a supplement, it won't get into your body. And sensible sun exposure is okay. And we'll talk about what that means. I thought I'd put some history of vitamin D forms, because for a while there, it was quite a fad in our country in the 1920s and 30s. And here, they even had vitamin D fortified hot dogs, vitamin D in beer, cod liver oil. They put vitamin D in soaps as well as custards. And that had to stop after they saw an increase in some small groups who were vitamin D sensitive, and they developed what's called high calcium hypercalcemia. So now it's just very tightly regulated in milk, and they don't put too much in just because you don't want to create a problem in those who might be sensitive. So here's a quick list of vitamin D food sources. Cod liver oil was historically something that mothers gave their children after the discovery of rickets. And 1 tablespoon has 1,300 IUs per serving. And we right now supplement at 1,000 to 2,000 IUs if we're giving supplements. So it's still an excellent source of vitamin D as well as omegas. Swordfish and salmon are the next best sources. Everything else is pretty much lower, almost equivalent to milk or less. So if we look at sunlight, how many minutes of midday summer sun is needed for an adequate vitamin D? In some hemispheres, it is better you can absorb all the vitamin D you need, and your body will store it for the winter months. And if you are a youth and you just expose your hands and face, which is about 12% of skin exposure, it takes about 42 minutes to get an adequate storage of vitamin D produced. But as you can tell, in Seattle, it's a little different. If you are more exposed, it takes less time and to develop your adequate stores. Now, factors that affect our absorption, besides just clothing and sunscreen, if you have sunscreen on, you block all UVB radiation entry. But one thing that I think you'll find interesting is air pollution, including nitrous oxide and ozone is common, and including in this article, and this is a great review article out of Boston, and I'll show you the reference later, it mentions San Diego. And pollution absorbs all the solar UVB radiation and therefore reduces the effectiveness of sun exposure in producing vitamin D in our skin. And the amount of UVB radiation is reduced by the increase in sulfur dioxide interestingly, San Diego and Los Angeles. And you guys will be really interested in this graph, which really surprised me. We're the highest in sulfur dioxide parts per meter measured in an hour period in San Diego. And as you all can recall from my respiratory effects of wildfire conversation, our particulate matter concentration is actively monitored in various regions throughout our state. So this is accurate data. So let's talk about how vitamin D actually is produced in our body. And when you all ask me questions about vitamin D, and I talk about diet, or I talk about your kidney function, or maybe liver function, when you ask me a question, this is the image that's in my mind as I ask questions of you. And I know you may think that, oh, I'm kind of jumping all over the place, but it's because I'm trying to assess at which part in this pathophysiology we may be offering you benefit, or I have to worry about your kidney function or some decline in your kidney function that would impact the dosage of vitamin D or what your calcium level is doing. So if we look at the skin, and I mentioned the UVB radiation affects our skin, and it it doesn't take too long, maybe 20, 30 minutes, as I showed you before. The UVB radiation triggers a reaction at the membrane of our skin where we have little fatty acids, dehydrocholesterol. So we have a lipid bilayer underneath our skin, and that is stimulated by the UVB. That creates a breakage in some bonds, which then creates the pre-vitamin D, which is considered a hormone, but it creates pre-vitamin D, which then goes through further processing in the skin layer to become vitamin D3. This is then enters our circulation and attaches to vitamin D binding protein. And then it goes into the liver where it's further processed, and then into a more active phase, vitamin D3 and D2, which then goes to our intestines, bones, immune cells, and even in tumor. If we had some type of aberrant formation of cells, we're always repairing our body, and vitamin D is felt to help in that process. This UVB light that enters our skin also creates other beneficial vitamin D byproducts, which are considered anti-inflammatory, immune enhancing, even at the skin level. So there is some anti-skin cancer properties with it as well. So it's our skin in this situation is very sophisticated in vitamin D absorption or manufacturing, as well as the effects of its byproducts. The vitamin D3 is 100% bound to the D binding protein that is made through the skin. Now, if we look at dietary sources, which we talked about earlier, it goes through our GI tract, sorry about that, and then enters the circulation. When it goes through our GI tract and it's processed, 40% is delivered to the liver through fatty cells, because it takes fat cells to kind of process through our system, and it gets kind of processed out. 60% enters the circulation. So the skin and UV light is probably the most efficient way for us to generate vitamin D. And a supplemental source is through the intestine, but only, just keep in mind, 60% of what we ingest is actually absorbed. So there are many respiratory benefits of vitamin D, and I, as a pulmonologist, it's been entering our world over the last decade, these conversations, and this is a great summary on vitamin D and allergies and asthma. And It's been known to promote some of the conversational cells that are needed for allergy stimulation. It helps our B cell and immune function in allergies, and it also helps decrease your production of allergy cells called mast cells. And if you look at the history of sun, in early rickets history, and they noticed kids who had rickets were also prone to respiratory infections, they would put those kids on the roof of hospitals, and they found that they would do better. If you look at TB sanatoriums, they were not only at altitude, but sunlight was a part of the treatment, because we know these macrophages are an important immune mediator of the lungs. And now we're finding the same with COVID. As with asthma, COPD, and even maybe cystic fibrosis. So those are some of the diseases that have been shown to improve a little bit if we make sure vitamin D levels are at the levels they need to be. In terms of overall effects of vitamin D, we also know that it helps prevent osteoporosis, because without adequate vitamin D levels, your body will only absorb 10 to 15% of dietary calcium. It also has been implicated in cardiac disease, maybe with high blood pressure and decreasing myocardial infarction. There is an association with a decrease in colon cancer. And actually, the U.S. U.S. Preventive Services Task Force feels that for every 4 nanograms, for like 4 points increase in circulating concentrations of vitamin D, you get a 6% reduction in colon cancer. There has been some beneficial effects noted with maintaining vitamin D levels in prostate cancer and perhaps breast cancer. There is anecdotal reports that higher supranormal, like at levels of 100 of vitamin D, may increase risks for pancreatic cancer. So keeping levels within normal range is very important. It also has been implicated in diabetes and perhaps even decreasing diabetic neuropathy. There's a large collaborative group, the Intermountain Heart Health Collaborative Study out of Utah, that showed in more than 40,000 participants, a level over 30 significantly, well, I should have said this, a level less than 30 significantly increased the incidence of diabetes, high blood pressure, and vascular disease. So sorry about that typo. In MS, there have been observational studies that showed that being born and living at the first 10 years at a certain latitude in the north compared with the south increases the person's risk of developing multiple sclerosis by 100%. Now, that's an observational study. The other thought, there's another observation that schizophrenia and mental health is connected with vitamin D levels. It seems to be that schizophrenia is more common in Scandinavian countries, as well as depression. We do know that vitamin D can enhance endorphin production, and that there is somewhat of a link that if early in your life you had a significant amount of vitamin D deficiency, maybe there's a link towards Alzheimer's. So these are observational associations, but it's interesting. And we do know that deficiency does cause disease. This was just released this month from the UK Biobank. Now, it's a large all risk mortality cohort study looking at just vitamin D levels and all-cause mortality. And they looked at maybe keeping levels at 45 to 60 may be the ideal way to reduce premature death. And this included nearly 365,000, over 365,000 participants with no history of cardiac disease, diabetes, or cancer, and they just looked at all-cause mortality. The funding was by the Science Foundation in China, so right now we are kind of questioning their data mining, but it did make headlines in our kind of news feeds that maintaining an adequate level of vitamin D did reduce the risk of all-cause mortality, coronary vascular disease mortality, and perhaps even lung cancer mortality. We can't definitely say cause and effect is implicated here. However, if we look at Harvard, in 2017, they did an analysis of over 11,000 patients, and it was a global meta-analysis. They looked at studies all over the world. And they found that if we could maintain our adequate levels, that's between 30 and 60 nanograms per ml, you could reduce respiratory infections by 50%. So we mentioned heart attacks and cardiovascular effects. So if we look at vitamin D, there is a thought that there is an effect on dilation of the blood vessels, in smooth muscle relaxation, in helping turnover and building of the cells that make heart cells, in the dendritic cells. Dendritic cells are nerve communication cells for these are T helper cells, which are immune cells. And the macrophages, if you remember from our prior COVID conversation, flu conversation, respiratory wildfire conversation, these are the workhorse cells in our lungs that are like Pac-Man. And they actually ingest bacteria, pollution, smoke, inhalation, everything. They are the workhorses, and they help our immune system function. And so here's where all of the different cell mediation can happen for our cardiovascular system. So I mentioned previously that the normal range of vitamin D is 30 to 60 nanograms per ml. The Endocrine Society of America recommends maintaining a supplement of 1,500 to 2,000 IUs a day, but that's if you are deficient. We will adjust your doses depending on how your body responds to levels. What happens if you have low levels? Under 30, it's you are considered deficient. That may increase the risk of rickets in infants and children, and what we call osteomalacia, or poor bone formation in adults, and risk for osteoporosis. Keeping levels between 30 to 50, I actually push it to 60, is better. And I don't think they meant to put in inadequate, but I think they're saying if it's less than that. And emerging evidence links potential adverse effects with super high levels. I think we've seen safety at greater than 60. I would say at 90, I start reducing doses. So remember I mentioned respiratory infections. Well, this is an ad that was taken off the internet from the I would say about 40s, 50s. But Scott Brothers in 1876 or 1873 noticed that drinking cod liver oil was commonplace, but it tasted horrible. And they created an emulsion and a market for cod liver oil to be sold. And they, to this day, are still selling cod liver oil. And it was marketed to reduce colds in the home. And so we are getting back to those days. And there was an association with respiratory infections 100 years ago. As I mentioned before, and it's a good reminder, fatty fish which like tuna, mackerel, salmon are all sources of vitamin D, as well as these some of these foods, but they're very low. But if you were going to have salmon, it would provide about 400 IUs of vitamin D. Not up to the 1,000, 1,500 sometimes we need if it's winter time, but maybe that's important to keep in mind to increase our fish intake, especially if it's winter and we're not getting enough sun. Supplements for vitamin D, many of you are aware that I have found that in my years of experience on this topic, I've been a vitamin D advocate, believer for at least 10, 15 years. And the history of that is that about 20 years ago, we were seeing a lot of osteoporotic bone fractures. And we were recommending calcium and hormone supplementation with estrogen for women. And still we were seeing progression of osteoporosis. I was recommending 1,500, 2 grams of calcium, and still the bones were continuing to, bone density was continuing to decline. And then studies started coming out about how vitamin D levels were low in our population. And we hadn't really been checking. We thought vitamin D in milk was adequate. And then we found everybody was seriously deficient, and we started supplementing. And we found that once we started supplementing, bone density started to normalize or stabilize. But then when we supplemented with these gel caps, I was having to increase doses to 5,000 IUs a day, or writing prescriptions for 50,000 units a week. And I could not get serum levels to rise maybe to between 30 to 40. They would only jump up by a couple of points. And then I came across this product shopping about 7 years ago, 6, 7 years ago, at Whole Foods. And I thought, wow, interesting. How can they make these claims that it's ultra potency and easily absorbed, gluten-free, soy-free? But I thought I'd try it, as I had, with my tan skin and always being indoors, had been diagnosed with a level of 7, which is significantly reduced. And just taking this little supplement was able to raise my levels tenfold. And I started recommending it to others, and found that I no longer need to write a prescription for vitamin D. And most folks who are taking one of these chewable supplements are able to increase their serum vitamin D levels by 10, 20, 30 points. So I'm a believer in a chewable form of vitamin. Maybe there's increased absorption through the GI tract, whereas if it's in a gel cap, maybe our digestive enzymes aren't active enough to break down those pills, and then it may bypass the ileum and absorption in the where it needs to happen. So if we start chewing it, and the sugar probably helps enhance absorption as well. I do not recommend you all going out and buying this supplement unless you've, and for family members that are currently listening to this conversation, you should discuss it with your physician and have your levels monitored actively. Because there can be something known as too much vitamin D. And because we can store vitamin D for months at a time in our fat cells, we can develop vitamin D toxicity, which is called hypervitaminosis D. It's rare, but potentially serious. That can happen when we have excess amounts of D in our body. This is usually caused by mega doses of supplements, definitely not by sun exposure, and not by dietary sources. As you can tell, our strongest dietary source only gives you 400 IUs in the form of fish. So you'd have to eat a lot of fish to be able to become toxic. because our body will regulate the amount of vitamin D produced by the sun, and even and so we don't necessarily need to worry about that if we have it from sun exposure. The main consequence of vitamin D toxicity is a buildup of calcium in your blood, and it's called hypercalcemia. And that's because vitamin D is a co-transporter for calcium absorption from our intestines. And that's why when we were giving all those vitamin D supplements or calcium supplements prior to monitoring vitamin D, calcium was just being excreted in the GI tract. The pills folks were taking were just going out the other end. But now we replace vitamin D and calcium is absorbed much more efficiently. If you have too much calcium in your body, you can have nausea, vomiting, weakness, and frequent urination. And it can also affect the heart. We also know that vitamin D toxicity can lead to kidney problems and even bone pain and the formation of calcium stones. So I am always cognizant of folks' underlying kidney and liver issues as well, because if you've had previously formed kidney stones, we will be reducing or not even giving you any vitamin D supplements because we do not want to enhance that formation of calcium stones. There are also other medical conditions, such as sarcoidosis or hyperparathyroidism, where if you have sun exposure or ingestion of extra calcium or vitamin D, you may develop hypercalcemia. So those conditions need to be actively monitored. So that is why we follow the levels, and these are conversations that have to happen with your provider. Because in our mind, that picture that you saw of the intestine, the liver, the kidneys, and all of the different disorders that are in our mind when you mention the topic of vitamin D are all there front and center when we have these conversations. So let's jump to vitamin D and COVID-19. This literature is just coming out. In prior lectures on the turmeric, we learned about nuclear factor kappa beta, which is activated and is when activated, it can become pro-inflammatory, but vitamin D helps calm it down. We know that the SARS-CoV virus attaches to the ACE2 receptor. And we know that vitamin D is part of, through the renal effects, part of what we call the renin-angiotensin system. Now that is how it impacts our blood pressure and our inflammatory pathways. Now, many people are on ACE inhibitors, the angiotensin receptor blockers, such as maybe lisinopril or losartan, which is an angiotensin receptor ACE2 blocker. So all of this is all interconnected. There is a theory here that because of vitamin D's impact here, our ACE receptors may be upregulated or if we are deficient. And if we have adequate levels, maybe we are able to modulate the ACE receptor and decrease our blood pressure and our cytokine storm. And we don't know if it really affects the attachment or not, but we are seeing that those folks who are vitamin D deficient seem to be more at risk for complicated COVID. And what this article did was just a population-based kind of wide lens, so to speak, on prevalence of D deficiency and COVID deaths. It does not mean causation, but it noted that those with higher prevalence of D deficiency, like in the UK and maybe Belgium, France, had a higher incidence of death compared to those with the lower incidence of D deficiency. This does not imply any causation, and this is a messy process because there's so many other factors implicated in COVID-19, in all the way to triage and life support systems and everything. But it is kind of an interesting association that I think needs to be teased out further. And this was just published ahead of print on July 17th. Here's another study that came out of Singapore. And they wanted to look at vitamin D, magnesium, and B12 supplementation in folks coming into the hospital. And what they did was between January and April, their numbers were lower. They looked at 43 consecutive COVID patients aged over 50, and they gave 17 received the vitamin D, magnesium, and B12, and 26 didn't. And they noted that those who had received the supplement didn't require as much oxygen, and they didn't deteriorate or as rapidly and go into the ICU as others. But they definitely recommended a larger randomized control trial to see if that really makes a difference. But it was interesting that they even thought to do this. These are things that are coming out in our literature right now about vitamin D and COVID. I think we do know enough about vitamin D and respiratory infections to say there may be an association. There's no harm in maintaining adequate levels if you don't have any other underlying conditions that would lead to high calcium levels. I'd like to have you all write this down or take a picture of this reference because it will dig deeper into all of the details that I mentioned on this lecture. And I think you'll find it an interesting read. If you need me to email it to you, I'm happy to do that. How often should you get your vitamin D level checked is a question. I definitely do it annually, and if you are significantly deficient, we will then reevaluate at about 3 to 6 months. Does sunscreen inhibit vitamin D production? Absolutely, because the sunscreen blocks UVB light from entering your body, so it will block production by 98 to 99%. With that, I thought I'd also like to share with you my Imperial County experience. It's just 2 slides because I know many of you have been asking as to what's going on with COVID-19 and what we did. There are certainly hotspots throughout our state. COVID-19 is increasing. The hospitals are starting to fill up. There are what's called overflow sites. We call them alternate care sites. And I was serving in Imperial County where there are only 2 hospitals. During normal routine summer months, their intensive care units maybe have 5 to 6 patients. They max can handle 8 to 16 patients in each ICU. And these hospitals were getting overwhelmed since probably the last 5-6 weeks to about 10 to 15 ventilated patients a day that needed to be transferred out. Since this time, probably about the California state has transferred out about over 500 patients from Imperial County for critical care. Half have come to San Diego if you've been reading some of the news reports. But what about those patients that don't need critical care? And those folks do need hospitalization. They need oxygen support. They need attention. They need to be isolated from congregate settings or from their home where there might be at-risk people for COVID. So that's where we came in to help. And the docs this is one of the state's lead coordinators for CalMAT, which is the organization that I work with. California has a California Medical Assistant Teams, and the governor's call out for healthcare volunteers come through that system, which is an organized system, kind of set up like police and fire, and with an incident command system. And this is our state medical director. And they were checking out this facility where we were taking care of patients, and we are actively taking care of patients here. And this is where we would put on our personal protective equipment and where we would take off our personal protective equipment. And the state did provide us plenty of protection. And as you can tell here, we have gowns, gloves, a face shield, and an N95 mask. And when we went into the alternate care sites, we considered it a hot zone. And I was able to work in there and take care of folks on oxygen, all with active COVID, for upwards of 3 hours. Now, and it was an honor to serve, but it was just a drop in the bucket. It takes easily 40 people to support an endeavor like this. We could do oxygen, physical therapy. It's like a mini hospital system. And we work in 12-hour shifts here. And the patients here were very grateful. We were able to discharge folks. They recovered. And it should hopefully provide a great deal of hope to everyone. There's a question here on the efficacy of vitamin D3 tablets as a supplement. I think we discussed that. I just wanted to make sure I don't miss everyone's questions. So when we take supplements, only 60% is absorbed through our system. And if it's a tablet, there may be further decrease in absorption if you don't digest that tablet. Skin pigmentation definitely affects absorption because we have melanin in our skin as protection from the sun. And maybe that is a contributor to why all of us with tans or pigmented skin may have lower levels and need to be checked regularly. There have been studies that have shown that in teenage years, for African American populations, Hispanics, if they had reduced vitamin D levels as teens and young adults, maybe that increases their risk for the development of high blood pressure and diabetes. I think that's why the CDC is saying it is a public health epidemic and our youth are at risk. So we're just drawing attention to this topic. And I think in medicine, all of us should be checking D levels in everybody at all ages. Another question came through. Would it be okay to take a teaspoon of cod liver oil daily? If you are going to do that, I do recommend, because it is a good significant dose, we monitor your levels. And I think that does it for the questions. Right now, I will stop sharing and stop recording this session. I appreciate all of your time, and if there's anything you need, please don't hesitate to ask, email, text me. And I thank you all. I think we are at 10:43. This is terrific.